The elderly patient population, for the purposes of our analysis on the outcome of the 302 study, was patients who were 75 years or older. Now, I personally know many men who are 75 or older who are quite young in terms of their physical health, but that was the definition. Now, with regards to the outcome, a couple things are worth pointing out. One is that this was an analysis that was done post hoc after the study was enrolled, and there were really two comparisons to look at. One is radiographic progression-free survival, and the other is overall survival. Now, in both the elderly and the overall patient population, there was a benefit from the use of abiraterone compared to prednisone alone. In the elderly, however, the overall survival, the hazard ratio for survival, was 0.81 compared to 0.71 in the non-elderly, the younger patient population. And that slight difference may be accounted for between 0.81 and 0.71. Might be a little bit different because of the risk of other causes of death in older patients. But in both cases, there was a statistically significant and I think meaningfully clinically significant improvement in the overall survival. Radiographic progression-free survival is basically measuring how well does abiraterone compared to abiraterone plus prednisone compared to prednisone alone delay the progression of the disease in the bone and elsewhere. And in that setting as well, the elderly enjoyed a benefit over the placebo arm that was statistically significant. However, the outcomes were a little bit worse than they were for the younger patients. The elderly patients had a slightly greater risk of developing progression-free survival, which is, I think, important to point out. But again, when it comes to the final conclusion of this elderly analysis, it should be stated that abiraterone is a perfectly appropriate therapy for elderly patients. We did not see any toxicity that was specific to the elderly patient population that would lead us to think that we should avoid this drug in patients above 75. Personally, I've treated patients even into their 90s with this drug with reasonably good safety and good results.